All right, good morning, everyone. Sorry, I'm running a little bit behind. This is Dr. Jake with F8 Well Centers. We are going to talk about a fun little, I would like to call it a consumer information video this morning. We are going to talk about a really, really important concept when you're trying to figure out medication, when you're trying to figure out supplements, when you're just trying to read the research or magazines or articles, or you see something on the news. This is potentially one of the most important concepts, I think, for you to understand, because patients come into us all the time and they're going to be on 3, 4, 5, or 6 different medications, sometimes 3 of them for the exact same thing. And a lot of times you either read or your doctor tells you, hey, this reduces your risk of having this 4 or 5 almost, sorry, I got to get that off. This reduces your risk by almost 50%. This reduces your risk by 30%. This reduces your risk by 80%. And this risk reduction is what we're going to talk about today and what those numbers actually mean. So a lot of times I talk to my patients about statistics and how lab work is actually analyzed and really how we need to understand the numbers. This is for people that are really considering are the side effects worth it? What's really the best use of my money and my time as far as treatment for my condition. So what we're going to do is I'm going to describe the general process of how do you get, I'll use an example for it, because I know cholesterol medication gets under a lot of scrutiny. And there is a ton of information online about it. So what we're going to talk about is if I develop a study and I want to tell a person or tell a doctor or something like that how effective something is. Okay, that's really what we're going to go to. So here's what's going to happen. Let's pretend I have a study. I have a medication or whatever it is. With this study, let's pretend I have 2,000 people in the study. 1,000 people get the treatment. They get something that I'm actually trying to go for. Another 1,000 people get what's called a placebo. So they get a fake, they get the sugar pill, and this is what's called the control group, is what the placebo is. Now, if I'm wanting to treat a disease, let's call it heart disease, you can call it diabetes, you can call it how effective is this music at making you calm, whatever you want to choose, it's the same basic concept. The control group, the placebo means they're not actually being treated. It's a fake, or and that's intentional. So let's pretend I treat 1,000 people with this fake, okay? And what winds up happening is only 2 people, or actually, let's make this a little bit easier. Let's go 4 of those participants have, let's pretend, a heart attack. So let's just go ahead and go with heart disease. So 4 of my 1,000 participants have a heart attack, okay? That's with the control group. Now, with the treatment group, only 2 out of my 1,000 people with the treatment have a heart attack. So essentially, or to make this maybe even a little bit easier for us, let's just use 100. 2 out of 100, 4 out of 100. So it's technically my absolute relative is 2% versus 4%, okay? So what I can tell you is my risk reduction. We can reduce your risk of having a heart attack by this treatment by 2% overall. That is called the absolute. So I would have a 2% absolute risk reduction. So if you have a certain condition, a certain disease or something like that, if you take this treatment, you can reduce your risk absolutely. But that doesn't sound that great. You're not going to get a lot of people to kind of buy into that. So what they do, and sometimes this is marketing, and because the scientific community knows and understands what both of these terms mean, we understand when they should be used and when they should be used. But if I'm a marketing guy, guess what? I like relative a lot more, because guess what I can do with relative? I can say, well, if you look at the numbers a little closer, if you take this treatment, you are actually 50% relative risk reduction. Okay, and this is a lot of times. There was a an extremely popular, I actually think it's in the top 3 or 5 medications used in the last like 3 to 5 years or something like that for managing certain symptoms of heart disease. And it was touted as it's 30% effective at reducing, or 36% effective at reducing the risk of heart attack. Well, what it happened to be is that actually happened to be like a 2 to 3 ratio, and 2 to 3 means a difference of about 33%, and then they rounded up a little bit for whatever cause or reason. But essentially, what we're saying is this is what gets advertised to you. And sometimes when you read the literature, or when you read a magazine, or when you read a doctor's report or whatnot, or a doctor comes in and says to you, and the reason, to be completely honest, I had a patient come in last week, and we were talking about a lot of medication that they were on, and it was quite an onslaught. And I asked them about one particular one that I've had experience with before, and I didn't know that medication to be used for what they were suffering with. And they said, oh, well, my doctor told me that there is a 58% reduction, like 58% chance better of improving my symptoms with that. And so I decided to look it up real quick, and when in reality, that 58% was almost exactly like this. And the problem was is that specific thing she was on was causing her an enormous amount of symptoms. It was causing dizziness, it was causing vertigo, it was causing nausea, it was causing her to miss work 1 to 2 times a week, eventually getting fired from her job. So this is just something when I told her, hey, look, this is the absolute ratio, and if it's causing this many symptoms and it's only reducing your absolute risk this much, go ahead and talk to your prescribing doctor about maybe changing some things up, because this is an important thing. So what this is not, I am not telling you to go and get off your medication. What I'm telling you to do is understand that there are studies that compare diet versus a medication. There are studies that do this versus that, like red rice yeast versus a statin and things like that. Understand that there are numbers and there are terms like absolute and relative risk ratios that are really, really important for you to understand and become more educated as a consumer. Sometimes your doctor knows about these differences between relative and absolute, and sometimes it's not. And I know the big question that a lot of people read, and I think someone popped it up, is how the heck is this not false advertising? Well, because they get to choose which number they want to use. And so the problem is, like I said, this is where sales and science generally don't like to mix that well. In the scientific community, actually both of these are very valid. And sometimes when you're using cross-comparative analysis, when you're using what are called meta-analysis studies, that is like me going in and researching like 20 different studies on this same topic. I want to compare relative and absolute because you can actually get a lot of information there. But like we said, if you're trying to push one specific thing, the problem with statistics and numbers is they are actually quite manipulatable. And so once again, this is not my intent to say, oh, this is bad and this is good. You should go here, you should not go there. This is to say, I really want my patients, because one of my biggest goals with working with people is to just allow you to have more education. Because I believe the educated patient is going to be the healthier one in the long term. To be skeptical of what I'm doing, to be skeptical of what your other doctor's doing, to be able to understand, okay, what research is there behind this? Because a lot of people come at us and say, hey, well, doctors say, well, there's no point, diet doesn't fix anything. Well, just for example, there was a research article done, and I'll have to get this to Brittany. It was done just a few years ago on the post-heart attack. Say you have your first myocardial incident. Post-heart attack, is it more effective long-term to reducing your risk of another heart attack? Is it more effective to take an aspirin every day or follow the Mediterranean diet? Well, here's the fun thing, and I hate to go too in depth with this for some people, but the last thing we have to talk about is this term called the number needed to treat. Number needed to treat. And essentially what this is the inverse of the absolute ratio, because sometimes they won't say absolute, sometimes they won't say relative. but a lot of times they'll probably say, and the NNT is. Here's a trick. The lower the NNT, the better the absolute risk. Because like I said, it's an inverse, okay? So the lower the NNT, if you see this in a research article, the lower it goes, the happier you should become, okay? Now, like I said, back to this, aspirin versus the Mediterranean diet at reducing the risk of future or sequela cardiovascular incidents. And the fact is they reported it as an NNT because this is a newer term that not a lot of people are familiar with. The NNT of aspirin was a 40. The NNT of the Mediterranean diet was a 22. So just talking about, because remember, the NNT is based on the absolute ratio, talking in absolute numbers, you had almost, once again, a 50% reduction in your risk of having another heart attack symptom if you just changed your diet, let alone having an aspirin, okay? So that's just one study that I find quite fascinating that proves this point kind of again. But remember, the NNT, so the NNT is basically calculated as the number of participants and the actual yield, so to speak. So an NNT of this would be essentially just the inverse. So it'd be like an NNT of like 200 or an NNT of like 200 or whatnot. And if you comparative the NNT or the relative NNT, it's still be about 200. But without going into all sorts of math and craziness and losing you, just understand the lower your NNT, if that's the number needed to treat. And essentially what that says, in order to get this 2, I have to treat at least 100 people. And this is where a lot of times doctors are doing the best they can because they don't know if this medication is going to help you, if you're going to be one of these, or if it's going to be the one that saves your life. But they do understand statistics and they say, hey, look, if I prescribe a statin or something like that to 1,000 people, guess what? I just saved 10 people's lives. So according to them, they are genuinely saving lives because they don't know if you're the one that will be saved or not. And so once again, when we start talking about this number needed to treat, we have to also understand this is basically coming from the research point of view to say, hey, look, if I have something that has relatively few side effects, and the problem is side effects are actually becoming more and more and more common. So they think, hey, it's just a normal side effect. Nausea is a side effect. Fatigue is a side effect. Those aren't big deals. But my biggest goal with patients is say, I want you to live optimally and happy and do everything you can. And if something's impeding that, then we need to just understand how much benefit versus risk it's actually contributing. So once again, this is not some public message to say, get off your medication, get off your supplementation, stop this, do this. This is simply, my goal is to help you have a little bit more information of understanding the absolute versus relative risk ratios. There is an enormous amount of information on this concept on the internet. And normally I don't like to just send you anywhere on the internet, but just start becoming educated on maybe my explanation didn't make a whole lot of sense. There's a few on there that I know make a lot of sense. I know there's a professor from Yale that does a really great breakdown of it and whatnot. And he teaches for Yale Medical School. And he just goes through this and gives you some real life examples. So my goal is to say, hey, look, whatever you're on, whatever you're taking, go ahead and start looking at what happens here. Because the interesting part is, even if they use relative risk ratio for advertising, even if it's these crazy, like we said, 50% effectiveness rate or relative reduction rate, even if they use that big number, normally there's an asterisk, normally there's a link, there's something that puts you to that study. And most of the raw research, don't be afraid to read research. It's really not that difficult. Most of the raw data will tell you, and the original research will tell you the relative and the absolute risk. And that way, especially like I said, if you're being on 3 or 4 different medications or 3 or 4 different supplements or something long term for a long time, they'll say you're going to be on this for your whole life. Go ahead and look and see what the numbers are behind it. The other thing I always want to make sure is we have to understand that where they're correct, I do not recommend people going off anything unless you're willing to make a change. And so let's use that example I gave of aspirin versus the Mediterranean diet. They didn't say aspirin versus nothing or the Mediterranean diet versus nothing. And so the biggest goal is you stick with whatever your doctor's giving you unless you're willing to start researching and making the change. If you're willing to start making the change and cleaning up that diet, trying some alternative stuff, if not, we have to understand that the body's in a pattern and it will likely progress to something a little bit more serious. So anyway, hopefully that makes sense. Sometimes I'm worried about going this technical or this in depth. But just understand this is a great tool for you to understand of what are the numbers behind what's going on and what you're taking. And then understand that there's other compounding effects. So the big take home is understanding relative versus absolute. And then once again, this is a term that's used quite a lot, but just remember, number needed to treat is a relationship more closely related to the absolute. And you want that number needed to treat being as low as possible. So if you have any questions, let us know. If you need more clarification, let us know. If you want me to revisit this topic with some more examples, just go ahead and shoot it in the comments. Brittany will let us know. I can do a little side video on this as well. That's maybe a little shorter and more succinct. But once again, thanks for following us this morning. And if you have any questions, we're here to help.